I want to talk more today about how we can be more proactive in reducing our risk of losing a pregnancy and why our system doesn't quite work that way at the moment. So, my name is Crystal Melanson. I am a board certified holistic practitioner and a functional fertility practitioner. And it's my goal to help you mend and maximize your fertility naturally to conceive and have healthy pregnancies. And so one thing that we know is way too common, right, is losing a pregnancy and having a miscarriage, right? So you probably know someone that has gone through this if you have not gone through it yourself. And if you have, then my heart truly goes out to you, and I'm really sorry for your loss. I know this is an extremely painful and difficult thing to go through. And right now, with our system, there's not a lot of support around losing a pregnancy, right? Oftentimes you're told to just, get right back on the horse, try again, right? Just kind of keep trying. And that can be really harmful, not both for your body, but also mentally, emotionally, because a lot of times women haven't even really healed from that loss before they're told to just kind of start trying again. And so what we want to do when we're talking about reducing risk of miscarriages, the first thing you need to know is if you have gone through this, it is not your fault, okay? It is not your fault that you lost a baby. I want you to really understand that. What we can do, though, is help you feel more confident, more empowered moving forward, and really optimize your health, your fertility, to help reduce the risk of this happening again, or ideally, right, ever happening in the first place. And so what we know is from research and evidence, there are ties to miscarriage risk that we have found. And I run a miscarriage risk, a panel. These are functional labs on every single one of my clients, whether you are just now starting to prepare to conceive, or if you have had losses before. Whether you are trying to get pregnant naturally or work in collaboration with treatments, I want to reduce your risk of losing a baby, right? And this is not to wait after 3-4 losses, which is typical, before we do anything. I want to start this from the beginning, right? To be proactive and not reactive. And so what we do with this is we want to look at the things that we know can increase your risk of miscarriage. So that's what could be damaging egg quality, right? Environment, nutritional factors that can be decreasing your egg and sperm quality. We want to look at your thyroid function really in depth and make sure that is optimal. Once again, not just normal, right? We don't want normal thyroid when we're talking about reducing risk. We want optimal thyroid hormones, right? Really functioning well. Autoimmunity is a huge component we need to address. Really identifying, seeing if we can find autoimmunity, especially within that thyroid, right? There are certain blood markers that we can look at that we want in a range. For example, ferritin, vitamin D, right? Ways to work and understand why they might not be there in the first place, homocysteine. We want to look at your mineral status that can be affecting these, right? Your nutrient levels, your microbiome in your gut. Yes, that can be really important for egg quality, but also your uterine, your vaginal microbiome. That is an important part to assess, what could be happening in your body for your fertility. And so we want to take this deeper approach to go to that level of what are these underlying factors that could be affecting your fertility and possibly increasing your risk of losing a baby. So there's a range of them that we want to go through and really understand. And this comes from that functional viewpoint, how I work with clients. Why this is not typically done at your doctor's office is two reasons. One, they just simply don't work that way, right? They are not trained in this way of looking at things, and we're trained in diagnosing the disease, right? The medications, the treatments, and they're not trained to look for those underlying factors. Also, they have to work, they work within this insurance scope where they have to be able to diagnose things, have codes, which, doesn't happen until there's this problem of maybe losing multiple babies, right? Our system is set up in this reactive way, not being proactive. It's an emergency health system, not a preventative healthcare system. And so you don't get this kind of care from your doctor. Now, what they do, which is important after sometimes is getting that physiological assessment, the structural assessment is what I mean, right? Is there something structurally wrong with your uterus that could be preventing a healthy pregnancy? That is an important component that can go in collaboration with this. But what you need to know is that there are things you can do to influence your fertility and carrying that baby. There are things that you can do to really help yourself feel more in control, more confident moving forward, more empowered moving forward, and more hopeful. And I think that's what is so important about this fertility journey, is really making sure that we're taking care of you, right? On that body level, but also that heart level, so that you can really have that journey, that supportive journey moving towards this baby that you dream of. So if you have questions on this, if you have experienced miscarriages, or want to look more to preventing them, please comment below or shoot me a message. I'm happy to chat with you and explain this maybe a little bit more in depth for you. But just know that you can take action and you can do things to help your fertility naturally. So if you have any questions, please let me know.